And next year will be $447 billion. $447 billion. The latest trustee report tells us that Medicare Part A will be insolvent in 8 years. In other words, we're going to increase the cost of a program that is going bankrupt in 8 years. That's not something we ought to do without a lot of thought. In fact, I don't think you should ever add trillions of dollars to a program that's going bankrupt. Now, this is why I think everyone, all of us in this room ought to be able to agree to this. There's a lot of fraud and abuse. In fact, President Obama talked about that. Tremendous amounts. In the city of Miami alone, it's estimated to be over $1 billion of false claims. And President Obama and Senator McCain both said they were going to address that fraud. It's not in this bill. It's not in this bill. Well, why don't we go and have a bill to address Medicaid and Medicare fraud? Let's clean up a program before we add to it. Let's repair the holes in the bucket before we pour more money into it. Now, the first gentleman, who was the first? We never got to the first question, did we?
Yeah.
Oh, okay. Oh, we did, okay. Oh, Janet Smith. Now, how about the gentleman from Warrior?
And Mr. Bachus, I'd also like to ask, what does this bill mean for healthcare employees and the incentive to obtain licensure that they need to take care of patients?
Okay, now is this the gentleman from Warrior?
Yes, sir.
Okay, what was the question? Now, wait, one question per person, he said.
Okay.
But what was your question? We're going to allow you two. You get the grand prize.
Yes, sir. Thank you. I was just asking what this means for hospital employees and their incentive to obtain the licensure that they need to take care of patients in the hospital.
Okay.
The healthcare reform bill.
What does healthcare reform mean to hospital employees, RNs, in regard to incentive to obtain the necessary training in the healthcare related field? That actually is a very good question.
Yes, sir.
We have a tremendous shortage in this country of nurses, trained nurses. We also have a shortage of doctors. There are a lot of people that say, why don't we increase enrollment in medical schools when we are actually not taking a lot of young men and women that are graduating with 3 9s and 4-point averages that cannot get in medical school. And yet we are taking people that are not citizens and training them here. Now, we can reduce the cost of health care for everyone if we will address the nursing and the shortages in doctors and nurses. But we won't address it when our hospitals are being reimbursed by Medicaid and Medicare at 85% of their cost. Now, how do the hospitals stay in business? Well, they stay in business because each of y'all, how many of you have private insurance? All right, you are paying 113% of the cost of medical care. So you that have health care insurance are already contributing to those that don't. That is one of the most massive transfers and subsidies, and you've not heard a word about that. Now, when people say, shouldn't you help? There's all kind of ways that you are helping the uninsured and those on Medicaid and Medicare today. And one reason is you're paying more, and your insurance company's paying more, so your premium is more because the government doesn't even have the ability to pay for the services now. So thank you. That was a wonderful question.